Family medicine is more than just basic health care. It's a primary care specialty based on the continual relationship with families and patients. The University Health Partners and John A. Burns School of Medicine has been treating thousands of patients for decades through this practice.
I've been a patient here for more than a decade. The most wonderful thing about it is connection with the university, medical school, because there's constant learning and transitioning going on. Physician Center at Mililani answered my needs.
Here at the John A. Burns School of Medicine, we are primary care specialists. Our mission is to take care of you and your family. And we want to provide the best comprehensive continuity care possible for you and your family, all the way from Keiki to Kupuna. In family medicine, one of our main focuses is actually in preventive care, and we do this for all ages. For instance, for children, we'll provide well-child visits, immunizations. For pregnant moms, we do prenatal care and OB care. For young adults or adolescents, we'll talk about lifestyles and make sure they're staying healthy. For adults, we talk about how to do good preventive care. Just as important for our Kupuna, we really want to make sure that they're able to stay healthy and active as long as possible, that they can stay out in the community either independently or with their families. Well, we also do a lot of team-based care. We work with specialists. So we're there to keep you healthy, but when you have a medical problem, you really want access to the experts as well. We work with your heart doctor, your kidney doctor, we work with specialists when you have a stroke, and we work with pediatric specialists or OBGYN specialists as well. We're there also to make sure that you have access to the care. We do the coordination, we make sure the referrals get made, and we make sure the follow-up gets made as well. We work with our pharmacists. We also have faculty specialists with specialty training in geriatrics.
I think my ultimate test was trusting them to my mother. Because one thing for me, right, but when you have a 90-year-old mother, then you have to think for her. I've trusted in the fact that they've given me referrals to other doctors and other hospitals when it's necessary. You know, I leave my life in their hands because that's what we really do with the doctor.
As part of the John A. Burns of Medicine, we are very evidence-based. What works, what doesn't work. So when you come to us, we really want to make sure you get the best possible care. This is our mission, this is our goal. This is why we come into work every single day, is to be there for the people that we were trained to serve. It would be our honor, and we would love to take care of you and your family. Just call our office and schedule an appointment. We'd love to see you.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Until 2014, Hawaii Public Schools had no nurses. Now the UH Manoa School of Nursing has partnered with the DOE to provide nursing care to a number of schools across the state.
5 years ago, Department of Education, DOE, realized that as they were focusing on improving attendance, student success, performance, that health was really impacting how students were doing, and they approached the School of Nursing. From there, I think, has grown this amazing program called Hawaii Keiki. Nurses bring a value added to the school setting because of that deep knowledge they have of health and the skill set they bring. Our RNs who are in some schools really work closely with teachers and see children. Our APRNs who are nurse practitioners are in a position to not only see a child, but they can diagnose and treat the condition, write a prescription for the medication, call the parent, tell them what they're seeing. Evidence around the country shows that when nurses are on campus, children come to school more. And in fact, 85% of the time when children come into our offices, we're able to send them back to the classroom within 15 minutes. It takes a lot of the pressure off the teachers and the principals in terms of health.
My name is Lisa Jakay. I'm a family nurse practitioner and I'm located at Castle High School. I work for the Hawaii Keiki program and University Health Partners. I love my high school population because I've gotten a chance to get to know them over the last couple of years. The biggest impact I feel I have on campus is with some of the emergency health services. We have children with seizure disorders or severe allergies. So I'm able to be here on campus and work in partnership with the public health nurses to get plans in place and also provide the reassurance of their safety.
Nationally, the CDC recommends that you have one school nurse for every 750 children, and unfortunately we're very far from that. However, we're growing. Our goal is really to have a nurse at least available to every school. We have 19 nurses who are covering 179,000 children. So the program is not in every school. We partnered with DOE to look at schools where they saw the greatest need. Most of our nurses are on Oahu. We also, however, cover Kauai and the Big Island, and then 2 nurse positions on Maui, but one of the nurses actually covers Lahaina as well as Lanai and Molokai. For people wanting to know more about the program, easiest way is to go to the website, nursing.hawaii.edu, and go to the page on the Hawaii Keiki program.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.